Hey, what's up, everybody? This is A.J., and I'm coming to you with another video, another update regarding my metoidioplasty. I'm at my doctor's office right now, waiting for my follow up. So I'll let you know how it goes, and I'll see you in a few minutes. Peace. Hey, what's up, everybody? I'm back. I've had my follow up with my surgeon. It's been 1 week post op, and he said everything looks great. So I'm going to walk you through everything that happened um, at my post op. So, well, I'm not even going to front. First, let me say trigger warning if you don't want to hear about different things concerning surgical sites or post-surgical sites, or if you're squeamish any type of way regarding bodily fluids or your anatomy, then I suggest that you click off of this video because I'm going in depth as to what happened to me today at my post-op visit. So click off now, go to another video, and then you can enjoy that video. But for those who are not squeamish, let me just tell you. So I went in to see my surgeon. It was good to see him. I hadn't seen him since after surgery, of course. And he wanted to take a look at everything, so I was already undressed from the waist down. I still had my suprapubic catheter, which goes in to my stomach, into my bladder. And I had the regular catheter that went into my neophallus, into my bladder. So the purpose for today's visit was to take the catheter out of the neophallus and to check to make sure that everything was okay. So I leaned back, he looked at everything, it was fine. And of course, let me say, around your neophallus after surgery, your surgeon will put that tape that sticks onto itself, that self-adhesive tape. They put that around your neophallus and around the catheter that's in your neophallus so that it will stay in place. So that's what I had there, just to give you a picture. That's what I had there. The purpose of today's visit was to remove that, to remove the adhesive tape and the catheter. What I didn't know was that he sutured my phallus to a couple of sides of my skin just to keep it in place. I didn't know that. Now, I can say that for the past week, anytime I tried to open my legs a little wider than usual or than normal, I would feel a pull. But I just figured, that was just the area healing or whatever. It was because of those sutures. So that was the first thing he had to do. He had to cut those sutures. Because they're so small, he had to find them. And the only way he could find them was to pull skin on either side away, which hurt like hell. I'm not even going to sit here in front and tell you that my visit was all roses and peaches. And no, it hurt. It really, really hurt. So once he found where those sutures were, he cut them away so that he could better access my phallus. So when the sutures were gone, he had to unravel the self-adhesive tape. Nope, that hurt. That hurt worse than him pulling to try to find the sutures. It hurt so bad, something came out of my mouth. I don't know what kind of sound it was, but I'd never heard it before. It hurt. It really, really hurt because it's self-adhesive, and it's on your phallus. And my my phallus is still a little swollen, of course, because it's only a week after surgery, so it's still healing. And he's trying to gently, now I will say, he's very gentle. He was very sympathetic to the point of asking me if I wanted to take a break and just wait. He was like, because I don't like causing people pain. And I was like, no, I'm like, it has to come off. Let's just let it come off. So what he did, he told his assistant to get some saline, to put saline on my phallus so that it could kind of loosen up the adhesive so that it wouldn't be as hard taking it off. So he was pulling and cutting with small scissors at the same time to try to get it off. It still hurt. I can't say that it hurt less with the saline because at that point, all I felt was pain. It wasn't a minimal pain. It wasn't a mid-range pain. It wasn't a maximal pain. It was just all pain for me. And I was just wishing it was over, but I knew that this was part of the process. So he just went on with it. He finally got that self-adhesive tape off. And then he told me to take a break because I would have to have the catheter removed next. And I asked him, is that going to hurt? And he said, I am not going to lie, yes. Which I appreciate. I appreciate him telling me that it was going to hurt. That way I can set my mind up for further pain. I waited a couple of minutes just to get myself together. And then he said, okay, so let's put some lidocaine gel on the phallus and a little bit around the urethra to kind of numb it so that I wouldn't feel it coming out. So they did that, and it worked a little, but I could still feel it because, of course, the catheter is in the bladder, so it's a little pull, you know. So he pulled that out. I felt it. It wasn't as bad as I anticipated, but I still felt it, and I did still scream. I'm not gonna go front. I'm not gonna sit here and tell you I was all macho and you know I took one for the team. No, it hurt. It hurt like hell. I did scream. I screamed the entire time, to the point where, you know, once everything was done and I went out to my fiance, I asked her, "Did you hear me?" And she was like, "No." And I'm like, "Oh, that's a wonder," because I screamed as loud as I could. But they took the catheter out, and then, you know, he gave me a mirror so that I could see what it looked like. And as soon as I placed the mirror and saw it, it was like all that pain just instantly went away because I saw what I wanted. You know, I saw what I had been waiting for. Everything that I had to go through to get to that point was staring back at me in the mirror. So I was like, that looks amazing. That looks absolutely amazing. So, I mean, he did an amazing job, an excellent job. So after that, I told him about the other catheter. The tape was coming up a bit, and he didn't like the placement of it. So he told his assistant to change the placement of it so that the bag can actually come up a little more on my leg, and so that the tube isn't as tight, because the tube was so tight it was pulling the I guess it was a bolster. It was pulling the bolster. A bolster is like this rectangle adhesive. It doesn't hurt your skin when it comes off, but it just keeps things in place. And I guess because it was so tight, the catheter was so tight, it just kind of pulled it up a bit, which I was concerned about. So when I told him and he saw it, he just wanted his assistant to readjust that catheter. And it didn't hurt. It doesn't hurt at all. So she just readjusted it so that it has a little more give. But the catheter has a holder on it that has a very strong adhesive that sticks to your leg. And you put the tube of the catheter in this little clip, and you close the clip to keep it in place so that the catheter hose doesn't move. I had to take that adhesive off. Yet more screaming, because it's so strong. When I finally got it off, a lot of my hair was on the adhesive. Wasn't pretty, you know. I'm like, you know what? And she was very sympathetic. His assistant was very sympathetic. So instead of putting that back on, she just taped it with surgical tape. I asked her, do you have surgical tape? Because surgical tape, it sticks to your skin, but it doesn't hurt your skin when you pull it off. And that's that white tape. So she put it on with that. She had the clear tape as well. She secured the catheter hose on my leg with the clear tape so that it wouldn't move. And then she readjusted everything. So that didn't hurt at all. And in 2 weeks, I go back to see him to hopefully remove the suprapubic catheter. But 3 to 4 days before my next appointment, I have to try to pee through my penis. So if all goes well and it does happen, then on my next appointment, they will remove the catheter that's going through my stomach. But yeah, it was painful. I'm not even going to front. It was very, very painful. A lot of people never told me that. I didn't know what to expect. I didn't know all of what was going to happen. I knew that the catheter from my penis was going to be removed. I didn't know all of that was going to feel like that. Like, I didn't know that they sutured my penis to like skin. And they had to pull it apart to cut it. I didn't know any of that, and nobody told me that. So that's why I'm doing these videos, to give you a clear picture, a vivid picture as to what happens during a metoidioplasty surgical update. Post surgery. I'm trying to give everyone who's going to have a metoidioplasty, I'm trying to give you a visual as to what it's like. Now, it may be different for you. It may be different for other people. Because I have heard some people say that the worst part of the recovery for the metoidioplasty is the suprapubic catheter, because they can feel it. It's irritating, it moves, or whatever. I haven't had that problem. I forget sometimes that it's there because I don't feel it. It doesn't move for me. It doesn't shift. I don't feel anything in my bladder. I don't feel it. So I can't have that same experience. I can't say that I experienced the same thing. So, like I said, everyone's experience is different. So the suprapubic catheter that I have, it's totally fine. I mean, I wish that it wasn't there, because it does get in the way when I'm trying to bathe. That's the only problem. And for the past week, I haven't been standing in the shower and taking a shower. I've been standing at the sink and washing my body very slowly. But I've been cleared to actually take a shower. So I'm probably going to do that. I'm going to give it another day, because my penis is so sore right now. It's really, really, really sore. It's still healing, of course. Still a little swollen. So because it's sore, I can't wear my regular underwear. I can't wear my boxers because it'll push up against my penis. When I left, now I will say, because they pulled the catheter out, I did notice when I was getting dressed that there was some leakage coming from my penis. It was just a little bit of blood, but I did check to make sure that everything was okay. They said, yes, everything was fine. That's just because the catheter came out. So they had me put gauze in my underwear that I was wearing to put pressure on it. Now, that hurt because my penis is very sensitive right now. It hurts. And because it's sticking out, so, I just had to kind of make a little cup around my penis and pull up my underwear. Now, the underwear that I'm wearing are the ones that I got from the hospital when I was released. They gave me this 6-pack of white cotton surgical underwear. So I've been wearing those because they're comfortable, they're flexible, and they're not restrictive.
So I still have those on. I'm probably going to wear those for maybe about a week because my other um, underwear, they don't have any pull. They don't have any give, especially in the waistband. Now, reminder, I had a oopherectomy, and that's the removal of ovaries. So I also had surgery in my abdomen. So me wearing anything tight around my abdomen is a no-go. So these underwear are the best because they have a lot of pull. Um, and from the oopherectomy, I have like 3 different small incision sites where they put the robotic arm. They did it laparoscopically, so it's robotic arms that they use. So those are healing as well. So I can't wear my regular boxers. I probably will never be able to wear the boxers that I have. I'm probably gonna have to just search out boxers that I will be comfortable in. And I've heard that from a lot of trans guys who've had metoidioplasties. What I did do when I came home, just to give my penis some relief, I took the gauze off. It wasn't leaking anymore. And I had a cup that I used for swimming that I would put in my swim trunks for swimming to make it have a bulge. So I took that cup, that swimming cup, and put it in the surgical underwear to give my penis a break. And it works. It actually works. It's still a bulge there. I don't care about the bulge. I just care about not having my penis rub up against anything because it is very tender. Um, it hurts, to be honest, when anything brushes up against it, even the slightest brush. And because it had that adhesive around it, around the sutures, and because it had a little bit of leakage, of course, it's a little sticky, so I'm gonna have to clean it off. So I definitely don't want anything like sticking to it because that's gonna hurt trying to take it off. But all in all, it was a good visit. Like I said, I didn't know what to expect, which is why I'm doing these videos so I can let people know this is what happens. The first follow-up post-surgery of metoidioplasty. Um, it hurt, y'all. Listen, I'm. It hurt. That whole unraveling thing and cutting the sutures and taking the catheter out. It hurt. So let me just get your mind wrapped around that. Then again, I shouldn't even say that because, like I said, it's different for everybody. It is. It's different for everyone. But all in all, I love the way my neophallus looks. I love the way my balls look. Everything looks perfect. And I'm just so happy. So my surgeon did an excellent job. My surgery is out of Mount Sinai in New York City. I live in New York. His name is Rajveer Purohit. And I will put his name in the description. He's amazing. He's absolutely amazing. He's a urologist, so I totally trust him, especially in regards to my urethral lengthening, because that's just part of his whole his whole thing. You know, he's a urologist, so he's really great, amazing, amazing. He does have someone who he works with, another surgeon who I'll be seeing in November. His name is Dr. Miroslav Djordjevic. He'll be doing my MLD phalloplasty next year. He only comes in the United States to Mount Sinai every 3 months. The last time I saw him was in May. He'll be here in August, but I won't see him until November. And then he said from there I will probably have the first stage of my phalloplasty in February. So I'm looking forward to that. But he works with Dr. Purohit, and they do some amazing work. I have never seen any work from other patients where they had something negative to say. Everyone had amazing reviews, positive reviews, great experiences, and I'm one of them. So yeah, that's my update of my first post-surgical visit, my surgical follow-up visit with my surgeon, Dr. Purohit, for my metoidioplasty. That's what it is. That's what it was. That's what it will be. So thank you all for watching. Continue to watch my journey. Whatever questions you have, just ask and I will do a video on it. If you have any questions about my metoidioplasty, my recovery, if you have any questions about transitioning or my transition in general, let me know. I'll do a video on it. It's no problem. Thank you for everything that you've been doing as far as watching my videos, giving comments to my videos, and I do comment back. Thank you, because this journey is incredible for me, and I just wanted to share it with all of you. So I need you to do me a favor. I need you to like this video, subscribe to my channel, hit the notification bell so you can know when other videos are coming, and I want you to enjoy the rest of your day, enjoy your evening, whenever you're watching this. Be good. And if you can't be good, then be good at it. A.J. out.